Hi, Nikhil. So this is the third part, and I'm going to ask you two questions here. From what you said earlier, a lot of it seems to be around communication between faculty and residents, and also about some level of conflict management, having avenues or spaces for conflict management, or I'll say negotiation and discussion. It's not all conflict. It is about, agreeing to certain things. So how what are your suggestions for that? And the second part is, I'm going to ask you, we've all been under stress. I've been under stress myself. And I presume that you have also been under stress. How have you managed your stress?
Right. So could you just quickly, I missed the first question a bit.
The first question, sorry, I'll ask it series wise. This is me, the problem here. The first question was, the difficulty seems to be communication between faculty and the residents. And sometimes it is about having the space to be able to talk about those difficulties. So are there such spaces in your department and the institution?
So like I said, residency, especially in surgery or in any post-graduation, you are there with your students almost the whole time, the entire time, when it is not like undergraduate teaching. Like you go, you talk for an hour or so, take your lecture and go off. Since we go to the department in the morning, we go to canteen together, we have coffee, then we have rounds, then we have OT, then we have academics, then probably residents do their own stuff, faculty do their own stuff. But the amount of time which the faculty and the residents spend together is significantly more when it comes to post-graduation or for that matter, super specialty. Again, in super specialty, since the departments are very small, the amount of time you spend with the residents is significantly more than as compared to general specialties. So I don't think there is a communication gap because of lack of time, lack of spending time with each other. I think the communication gap is mainly because of individual personalities of the faculty and the residents. Some faculty are not that open to interaction with the residents. And the other way is also true. Some residents like to keep their problems to themselves. There, again, one of the problems or one of the reasons which we had was conflict between the residents themselves, especially when it comes to surgery. It feels that way that faculty is sort of favoring one of the residents, that he or she is doing more surgeries, other individual is not getting that much of surgeries. So these are conflicts which I think can't be generalized. These are specific institution based, which the individual team there needs to look into it as to what are the local factors over here, and those need to be addressed. I don't think communication is the gap over here, and which has been addressed by sort of giving mentors to each and every residents. Now it is up to the individuals to come up and sort things out. I think one of the important things which our study did was that we opened up a Pandora's box. It was a sort of an unaddressed thing, especially in the plastic surgery fraternity in India. And the first thing I believe towards solving any problem is to acknowledge that we have one. So since now we know and we have acknowledged that this is a genuine problem which needs to be addressed early on, primary prevention, or rather I would say even primordial prevention is the way out of it. So I think things will keep on improving. And if we do a similar study 5 years, 10 years down the line, because this was a cross-sectional study at one particular point of time, 5 years, 10 years down the line, if we do a similar study, and if the burnout levels have gone down, I think as a fraternity of plastic surgeons, as faculty of plastic surgeons across India, we have been doing a good job. If not, I think we need more introspection, more aggressive measures to address this issue.
So it's so interesting that I think professional stress is the elephant in the room. Nobody talks about it. but it is there. And I think what you said about opening the Pandora's box, it is something that we are trying to do at ASHA, which is to increase the dialogue, the discussion about stress, so that we should be talking about it. If we don't, then you don't treat it.
Yeah.